Hey, this is Dr. Shishir Prasad. Hello, namaste, shalom, buenos dias. This is Dr. Shishir Prasad, and it's great to see you all here once again. I take this opportunity to thank Suvendu Mitra, who has requested me to talk on the topic of frozen shoulder, and especially how we do Marma therapy in cases of frozen shoulder. I thank Suvendu Mitra and the other organizers of the team for giving me the opportunity to be speaking in front of you. As Suvendu has told me, I need to wait for 1 or 2 minutes before I start talking on the topic. So I'll just wait for 1 or 2 minutes before we begin discussing about Marma therapy. I'll just give you a brief introduction about myself. I am working as an associate professor in Uttarakhand Ayurveda University, Gurukul campus, Haridwar, in the department of Shalya Tantra. So regarding this topic today, the cases of frozen shoulder are quite common, especially in musculoskeletal disorders. If you see, there are around 1 to 3% cases overall that you find of frozen shoulder. And Sushruth has mentioned about frozen shoulder as well, but although the terminology used is not the same, the terminology they have used is a bahuk. And Sushruth has considered it to be a Vata Vyadhi. And in the Vata Vyadhi Nidan, there he has described about a bahuk. And there are other acharyas also, and especially Madhav Nidan, they have mentioned about the etiopathogenesis about frozen shoulder or a bahuk. Basically, if you see the involvement of different dosha types, it is mostly the vata dosh predominance, and there is some kapha dosh also because the vata involves the akunchan of sira, and then there is sankoch. This is what Sushruth has mentioned, that there is sira akunchan. So if you go and see the etiopathogenesis and cases of modern system, then there also they have mentioned about two types of frozen shoulder. One is the primary frozen shoulder, and the other is the secondary frozen shoulder. The cause of the primary frozen shoulder is considered to be as an idiopathic, and the secondary frozen shoulder is that which is due to certain trauma. So or it can be due to certain other pathologies and associated with some diseases like diabetics or hypothyroidism, or in certain cases even hyperthyroidism. You find more occurrence of frozen shoulder. If we go and understand the concepts that have been given by our acharyas, they are very similar, because they have also said that there is a restricted range of movement of shoulder joint, and there is pain sensation, and there is a stiffness in the joint. And if you go and if you see the allopathic point of view, that there are 3 stages, and some of them have told about 4 stages of frozen shoulder or adhesive capsulitis. The 3 stages, which are like inflammatory, then freeze, when the time there is more freezing zone, or then there is one which is the thawing phase. So there are different, these are the different phases which have been described in allopathic terminology. And In inflammatory phase, there is more pain, and then when it goes on to in the second phase, then the pain starts to decrease, but the movement is gets more and more restricted. In the thawing phase, they say that it resolves on its own, and overall, the general consensus that then within 3 years, generally the frozen shoulder resolves on its own if there is no other comorbidities. However, it is again, some of the papers say that around 10% of this continues for even after 3 years. But 3 years, is a long time, and considering the fact that you cannot allow your shoulder to go on being stiff and painful, and it disturbs the daily routine activities. So we try to minimize the discomfort as much as possible and solve the patient's problem. So there are various modalities which have been described in Ayurveda for treatment of Bahuk. And what we are doing is doing Marma therapy for frozen shoulder or Bahuk. We have found very good results when we do Marma therapy. And the best part is it is quite fast acting. So generally what happens is patients tend to take more of anti-inflammatory drugs or go for physiotherapy procedures, which is always not possible for patients to go out and do it. However, they have their own benefits. Ayurveda has also told about certain procedures like Snehan and Nasya Karm for Abahuk. So we are just using the Marma therapy special techniques to give relief to the patient. Coming to the idea of which marmas to do and how to stimulate, we will be discussing that in more detail as we go on. And the best part basically with marmas is it is a non-invasive technique, and can also be taught to a patient how to do on their own. So self marma therapy can be done by patients. However, they will need to come for a few times regularly to the doctor, and then in front of the doctor, then they can guide exactly that. So see, this is the right point, and this is where you have to do and stimulate. Marmas, as we know, is an energy dependent science, and and marmas are also considered as the vital points. So we have to be careful when we are stimulating the marma points. So the patients need to come and then learn over a few sittings, and then do in the front of the doctors, and then can go and do it on themselves with precautions as described by the physicians. So but it can be practiced self marma therapy. That is the best part, and we have had many patients whom we have done first or second sitting or 2-3 sittings on our own, and then taught, and then make a follow up after say 1 week or 15 days, so that you know whether the patient is doing it correctly or not. Now coming to the description about the marmas, basically we are doing 4 marma point stimulations for frozen shoulder cases. We have had good results both in primary as well as in secondary frozen shoulder, uh, even those who are long standing cases. However, when it is associated with cervical spondylitis, then it takes a bit longer time, and also the onset of action will depend upon what the chronicity of the disease is, and also how many times you need to stimulate the marma points to get results will depend upon how early the patient walks to you. So, uh, coming to the description of the Marma points, as I said, we are doing 4 Marma point stimulation for frozen shoulder patients. However, I'm going to tell about those 4 Marma points in regard to this frozen shoulder, the same Marma points we are using for other pathologies as well. So it is important to understand that one Marma point can be utilized in other cases or other diseases also, right? However, we need to learn first the stimulation technique, the identification, and first do it on as we guide you, and then if you are a doctor or if you are a specialist, then you can expand. As Ayurveda always say, yukti upar yukti gyo. So one has to use the yukti and give benefit to the patients. So the 4 points that we will discuss today are Ansamarma, Kakshadhar Marma, Kurpar Marma, and Chaperones. I will repeat once again. The 4 points that we will discuss today are Ansamarma, Kakshadhar Marma, Kurpar Marma, and Chaperones. And this is the sequence that we follow for stimulation of the Marma points. Now, coming to the description of the Marmas, how to identify one by one, I'm going to explain how to identify each of them, what is the method of stimulation. So basically, to identify the Ansamarm, you have to fold your elbow like this. Okay, so fold your elbow this like this, and this is the mid axillary line. Okay, so from here you make approximately 45 degree with the elbow. Okay, and keep the elbow close to the chest. Keep the elbow close to the chest, and then with the help of the pulp of two fingers, the index finger and the middle finger. So these parts of the finger we will be using for stimulating the Marma point. So once you have put it like this, then you fold your elbow like this. The point at which your fingers reach, you don't have to stimulate here. You have to go slightly inwards. Okay. So this is the point. Basically, this is on the trapezius, and once you have identified the point, you make an imaginary line. You make an imaginary line from this point to the sternal notch. From this point to the sternal notch, you make an imaginary line and apply pressure. Try to apply pressure in this direction. So again, I will repeat. Once you fold it like this, you go slightly inwards and then apply pressure like this. Okay, so you can see my finger. So this is press and release, press and release. It is in one sitting 20 to 25 times. One press and release will take approximately 3 seconds. Okay, so I will repeat once again. In one sitting, we do 20 to 25 times. Intermittent stimulation. It is not a continuous stimulation. Like if you are pressing it like this and you keep pressing it, no, you don't have to do that. And keep pressing and releasing, pressing and releasing. So this is an intermittent pressure. The amount of pressure that we apply is approximately 8 to 10 pound of pressure in a normal young adult. The pressure will vary as per the patient's sattva, age, and the prakriti. Those things have to be considered while stimulating or giving the amount of pressure. What you have to understand is what direction you have to apply the pressure. Another point which is very important here to understand is you don't go too far towards the neck area. Okay, so once you have put the finger here, don't go close to the neck. So the point at which the neck joins the shoulder, from here, from this point, the distance of the Marma point is 2 finger breadths away. From here, this is 2 finger breadths away. Okay, so I will repeat once again this one. So the neck joins the shoulder at this point. Okay, at this point. So we have to be careful not to stimulate on this side, but go away from the point. And then with the help of two fingers, we press it like this. So you have to imagine a line from this to this and try to apply pressure in this direction. However, when you are applying pressure in this direction, the exact uh, line of uh, uh, line of pressure will not be exactly from here to here, but it will go somewhere in the midline of the body. But it is difficult to imagine a line somewhere in the midline of the body. So that is why we say that you imagine a line from here to here and then apply pressure. And another point which is important is to know that another point which is important is to know that we don't have to stimulate both of them together, not like this. Okay, don't do both the marma stimulation together. Do it one by one only. Otherwise what can happen is you can feel giddiness or dizziness, like feeling, and then because there are many major vessels passing through the neck area, and you can result into hypoxia. So it is important not to press both of them together. Press it one by one, and also not to go close to the neck and away from it. It is okay to go slightly away, but not okay to go closer. What I mean is, if it is okay, if you don't find the point here, the right point, it is okay to go slightly like this, right? So this is okay, not too far, not like this, because there are again certain vessels and nerves which is passing through this area. Okay, so you don't have to go like this. Slightly away you can go, but don't go close. So this is the method of stimulation of ansmarm. One by one sitting, 20 to 25 times. One press and release will take approximately 3 seconds, and in one day, 2 to 3 times in a day. Now we come to the next marma point, which is the Kakshadhar marma. The Kakshadhar marm lies in the deltopectoral groove. So if this is the clavicle, this is the clavicle bone, right? So this clavicle joins this shoulder. Acromioclavicle joint is here. Okay. So below this, on if one can feel here, there is a slight depression. Those of you who are watching and started already doing it, please don't do it. You have to wait before you can do it on yourself. Okay. So what is important is to see that see the bony landmark, go towards the acromioclavicle joint, and then approximately 1.5 finger breadth below. Okay, this is more a groove like structure. You will find a slight depression is here, right? So once you have found the location or the site of the marma, then the method of stimulation is we have to press from here in the direction backwards and upwards. That means that from this point, the direction of pressure is approximately 45 degrees upwards. Never go downwards, because there are certain vessels and nerves passing through the area. So never go downwards. Always go backwards and upwards. Okay. Now I'm going to show you how to do it on yourself. That is this self marma therapy for Kakshadhar marma stimulation. So you hold your shoulder like this, and the thumb goes here. Okay. So hold the shoulder with the help of the palm. The thumb goes here, and then you can press. Then you can press backwards and upwards. Not like this. I'm not. We don't do a circular motion, and we don't use any oil for stimulation of this marma point. And other marmas also, I am not using any other oils for stimulation. However, there are some people who are doing with the help of oil massage they're doing. So that is also good. I don't deny anyone. They have their own expertise. But what I'm doing is I'm not using any oil for stimulation. It is again here also the Marma stimulation is 20 to 25 times in one sitting, and 2 to 3 times in a day. One press and release will take approximately 2 to 3 seconds. So, so yeah. So the next what I'm going to show is how to do on someone else. So I have to show a picture for that. I'll try to bring it on my another laptop, this picture, so that we better visualize how we can do it on other patients. Okay. So yeah, I think now you can see basically the Marma. Yeah. Okay. Right. So here you see this is the clavicle bone, no? And I have held the positioning. I have given the positioning. Okay, with this is the thumb and site of stimulation. So this is more the bony prominence, and then you go 1.5 to 2 finger breadth below. Don't go down. Don't go here, because then you have the brachial plexus and vessels which are going through the area, and then if you go down, then it can result into injury. So we should not be going down, but go uh, backwards and upwards. So you can measure again. I will repeat from this point to this point, 1.5 finger breadths, and then you can locate a groove like structure, and then in the groove like structure, from there you have to put your forefinger. The forefinger that you see here is for support. The patient is sitting. This Kakshadar, the marm is basically done better in sitting posture, as well as the Ans marm is done better when the patient is sitting. Marma therapy basically can be done in supine as well as in sitting posture, but never should be done in standing posture. Preferably, if the patient is sensitive, and then it is better to do it in supine posture, or supine means patient is lying down in bed, and then you can do. Okay, so this is how, again, I will repeat. So we put the forefinger in the back, and with the help of the pulp of thumb, we just put the pressure and then release it. Press and release, that is all we do for the stimulation of Kakshadhar Marma. Now, coming to the next Marma point, which is again a very important Marma, and that is the Khurpar Marma. So now I'm going to show you how to identify the site of a stimulation of Khurpar Marm, and then I will show how to do self Marma therapy. Okay. So this is the elbow joint. You draw a line, you make a crease, elbow crease. Okay, so this is everything. Everybody can visualize this. So you make a line on the elbow crease and go 1 finger breadth below that. And here also you go 1 finger breadth. So basically the Khurpar Marm lies both on the medial aspect as well as on the lateral aspect of the elbow joint, and uh, 1 finger breadth below the elbow crease, both medially, or both on the internal aspect as well as on the outer aspect. Now, this is one of the marmas which is painful when first stimulated. So we have to prognosticate our patient that see if when you are stimulating this point, there can be some tenderness. So you take deep breath in and out, and prognosticate your patient that there will be pain basically when first you stimulate it. But the pain will not persist for long. It is like not like you press and it persists for a very long time. No, after stimulation the pain will subside. It is only during the time of duration that one generally feels the tenderness. But every patient has to be prognosticated, and this Marm point should be done in mm, empty empty stomach. Okay, so again I will repeat, the Cooper Marm should be done empty stomach. However, in diabetic patients, this should not be done completely empty stomach. You can do in diabetics also, but do it in after the patient has taken something like 2.5 3 hours before. Okay, and also in such cases we should ask our patient to lie down, and diabetic especially don't do it in sitting posture. Okay, sometimes the patient can have nausea and vomiting if you're pressing hard, so you have to be careful not to press too hard. If that happens, then when patient has to ask to lie down, raise the limb, and then it normally takes care of itself within a few minutes. So I will repeat. Once you have identified one finger breadth below here, then the medial point of it, the technique of stimulation of the medial side of Cooper Marm is by holding the arm like this, and with the help of pulp of thumb, we put it here and make an imaginary line from this point to the bony prominence here. So imagine a line from this point to this point, and then apply pressure in this direction like this. Okay, so with the help of pulp of thumb, we put it here, hold the arm. The direction is from this point to this point. Elbow should be slightly flexed. Don't keep the elbow straight. If the elbows is completely straight, then the muscles become stout, and it is difficult to stimulate the Mama point correctly. So the elbow should be slightly flexed and palms facing upwards, not like this. Okay, the palms should be facing upwards. So this is the method of self-stimulation of the internal aspect of the Cooper Marm. This point is also important in those patients who have golfer's elbow. So the medial aspect of Cooper Marm we do for golfer elbow patients, and the lateral aspect of Cooper Marm we do for tennis elbow patients. However, besides this, we also use two other points for tennis elbow as well as golfer elbow patients, and have found very good results. Like there have been some acupuncture specialists who have had tennis elbow, and they have tried earlier other techniques. There have been some physiotherapists who have used other techniques, and they have also done Marma point stimulation for such cases, and they have found very good improvement. So again, now coming to the second point, that is the outer aspect of the Cooper Marm, how to do the self stimulation technique. So they put the thumb on the bony prominence and extend two fingers like this. Okay, so I put the thumb on the bony prominence and then extend two fingers like this, elbow flexed, and from this point to this point I will make an imaginary line, right? And then apply pressure like this, press and release. This is painful in everyone, even if the patient is not having any pathology. So even then, the patient, because there are certain nerves which is passing close uh, to the joint, to the area where you are stimulating. So that is why it is tender, and but also very helpful in treatment of both cervical neck pain as well as in frozen shoulder cases. Also, we are doing in cervical spondylitis patients. And other pathologies, we are doing this Marma stimulation. So it is not that we can skip this Marma and go on to the next one. With precaution, it has to be done, and under medical guidance, and then we get the benefits. So I hope so far I am clear, and then I will move on to the next Marma point. So I'll add one more point here. Suppose somebody has a cervical neck sprain. So when you sleep and sometimes wake up in the morning, you get a stiff neck, or when you are traveling for a longer duration, long flights from here, Delhi to New York is 16 hours. So if you travel and have a neck sprain and don't have any medication to take, then there are two Marma points. If we stimulate correctly, it greatly helps to take care of the pain and stiffness, and hardly 3 to 4 times of stimulation is sufficient. So those two Marma points are the Ans Marm and Kurpar Marm. Okay, so only those 2 points. This is the Ans, as I discussed earlier, and Kurpar. If we can stimulate only those 2 points for cervical neck sprain, many of the uh, people who are sitting for long hours on computer, and many of the technocrats, they tend to also have that neck stiffness. So in such cases, only two Marmas, on the Ans and Kurpar, is sufficient. Now I'm going to move to the next Marma point of stimulation, and that is the Chaperones. The Chaperones basically lies between the thumb and the index finger. There are total 4 Chaperones, 2 in the upper limb and 2 in the lower limb. There are total 4 Chaperones, 2 in the upper limb and 2 in the lower limb. Today we will be discussing about the upper limb Chaperone identification and stimulation. So if you make your index finger like this and the thumb here, okay, so if this is the webbing, from the webbing you measure 2 finger breadths, okay, in the center. So this is the site of Chaperone. So this is just for identification how this distance is 2 finger breadths from the webbing to the point. So this is the Chipra Marma. Now when we are stimulating, then first make your index finger like a hook and place it on the thenar eminence. So this is the thenar eminence, okay, the prominent area of the palm. So you have to place it on like this here, and then the thumb goes here, because there are many books which say that the Chaperone basically lies both on the palmar aspect as well as on the dorsal aspect. So when we are putting our index finger here and then applying pressure from this side, we are basically stimulating both the sides, right? So make a finger like a hook, put it here, the thumb goes like this, and then you press and release. Right? The direction of pressure is important, slightly towards the thumb, around 15 degree towards the thumb. That is what we do, slightly towards the thumb. And if you are at the right point, you feel slight tenderness, not much pain, only slight tenderness is there when first is stimulated. Okay, so this is again All the four marmas which I discussed today, we will be doing it um, 2 to 3 times in a day. One is stimulation, one time you do 20 to 25 times press and release in one sitting. You do 20 to 25 times press and release. One press and release will take approximately 3 seconds. Basically, those marmas which are not vascular, we generally do it 20 to 25 times. But those marmas which are vascular, or which are known as sira marmas, then they those sira marmas we stimulate approximately 15 times. However, it is not a rule for all. There are certain marmas which we do not do an intermittent stimulation, we just touch is sufficient, right? So for example, hidden marma, so that we do not need to do any press and release in such cases. So there are certain marmas where we are following different methods of stimulation. But most, if you were speaking on a general term, then the non-vascular or the non-sira marmas we stimulate 20 to 25 times in one sitting. Okay, we have to be more careful when we are stimulating the sira marmas or vascular marmas. The amount of pressure that we apply in other ones like joint marma, so that is not the same as in case of sira marma. The amount of pressure that we apply on sira marmas are much lesser. Okay, so this was about the stimulation technique and identification for frozen shoulder patients. Out of these, four, we are using three in general for cervical spondylitis as well as cervical spondylosis patients, and those are the Ansumarm, Kurparmarm, and Chaperones. The difference will be like if you have a frozen shoulder in one side, so we will be using one side stimulation only. We will not be using both the sides. But if the frozen shoulder is associated with cervical spondylitis, then we will use both side Kurparmarma, both side Chaperones, as well as Ans and Kakshta. Both of them we will be using. So again, I think this is about Marma therapy for frozen shoulder. If you have any questions, I can take these questions now. Those who want to ask questions, they can write it here in the chat box, and then I will. Can you please repeat Chaperones? Okay. So the Chaperones, you have to put your index finger here and the thumb like this. Okay, so once you see the point, generally what people do is apply pressure directly downwards like this, but this is not what we do. We push it slightly towards the thumb. The pressure is slightly towards the thumb, not completely towards the thumb, but slightly towards the thumb. And the finger should be not straight, not like this. Don't keep the finger like this. Okay, your finger should be slightly flexed, like you're holding a glass of water. So okay, so that way the muscles here are more relaxed, and then you can easily stimulate the marma point. This is a very important marma because there are some books which say that it controls prana and vyana vata, so it is an important marma point. Okay, now the next question is, when should kakshadhar marm be pressed? So in frozen shoulder cases, we are using kakshadhar marm. But if the patient does not have a frozen shoulder, if the patient is only cervical spondylitis, okay, then we don't need to stimulate kakshadhar marm. However, suppose if there is certain implants or certain other pathology, like if somebody has a deep vein thrombosis, then you don't stimulate the murmur point. The patients having cardiac pathologies and pregnant ladies, better to avoid initially. Okay. If not only shoulder, like frozen shoulder, there are other pathology involving the shoulder joint, like osteoarthritis in the shoulder. In that case also will need to press the kakshadhar marm if the patient is of bicipital tendinitis. So in such patients we do kakshadhar marm stimulation. Okay. Now I'll take another question. The question is, please teach the other two Marma points for tennis elbow and golfer's elbow. Actually, you see, this is a topic of discussion in one of the classes next week, in which I am going to specifically discuss about tennis and golfer's elbow, and then in that session, I will be discussing in detail about which marmas we do and how to stimulate. So please, I will share the link here on this page so that you can join that session. Which oil do you recommend to apply on marma points? That depends upon the kind of dosha involvement is there. Like the commonly used ones are Mahanarayan oil, Prasarani oil, right? And in certain cases, if the pitta the predominance is there, then Chandan Bara Lakshadi oil can be used. So depends upon what kind of dosha predominance is involved. If it is frozen shoulder, then you can use Prasarani oil or Mahanarayan oil. However, I'm not using oil while doing marma therapy. The question is whether you do both sides. Yes, one first complete one session and then go on the next one. And the sequence is, if in the case of frozen shoulder mostly unilateral, and then generally in those cases, in those that which is a non-dominant arm, it is more. Okay. So in certain cases, it can be bilateral, like when the patient has some thyroid related problems. So then in that cases it can be bilateral. So first we will go from the top, from the ans, then kakshadhar, then kurpar, then chepra, one side, and then we'd go on the other side. So this is the sequence we follow. Just a moment. So if the patient is hypertensive, can we do this procedure? This is Ankur has asked me this question, and depends upon what type of hypertension, whether it is mild hypertension, moderate, or severe hypertension. Severe, you don't do it. Okay, if it is mild or essential hypertension, you can do it, but with certain precautions, like better to do it in supine posture, and the amount of pressure make it more comfortable to the patient, so that the patient does not feel too much of painful stimulus, especially while doing kurpar marm. Ans marm and kakshadhar marm, when you don't feel much pain. Okay, it can be unsmarm stimulation can be slightly tender, especially when the marmas are more blocked, when the channels are more blocked, then they become a bit tender. Okay. Anatomical understanding of marma, that is I think I will not be able to explain exactly on the on the live session here. uh, if just in broad terms, if you want to understand, then there is this, here is the trapezius, here just below the acromioclavicular ligament. On the elbow there are certain nerves like ulnar and radial nerve passing through the area. Okay, so these are the general understanding about anatomical location, and there are many people watching, not necessarily doctors. So when I discuss about in our other sessions, especially for doctors, we do take the anatomical considerations in more detail. Uday Kumar, could you repeat what is your question? Please once again repeat. Hans worm point. I don't understand. You wanted to say Ans worm? Ans worm? Minimum age. Another question is what should be the minimum age of patient for MARM therapy? As I go on and tell many of my workshops, the youngest patient I have treated is an 8-month-old child. But there are some people who are treating even newborn babies with MARM therapy. But I'm not doing in the newborn babies. The youngest patient I have treated is an 8-month-old baby with Erb's paralysis, had a brachial plexus injury because of birth trauma, and we were able to bring the shoulder and elbow movements back to a large extent after 2-3 years, and then but not able to bring the wrist movement back. Even it has already been nearly 2.5-3 years she's been under treatment, and not only Marma therapy. In such cases, we also gave Ayurvedic medicines and certain Ayurvedic oils. So that is the case even in secondary frozen shoulder. Okay, so you have to give certain Ayurvedic medicines, and maybe use some oils if it is a long standing case, for example more than 1 year, more than 2 year, sometimes even 3 years patients have. So in such cases we will need to give some oral medications as well as local application. If the patient walks to us early, like 1 or 2 months, so in such cases even a few sittings of Marma therapy is sufficient. The best part is we get very good results, and the range of movement improves even after first sitting of Marma therapy. As I did in certain live sessions, there was a conference in Bangalore where one patient, when I was talking about Marma therapy in frozen shoulder, one of the patient from the audience came and said that, sir, I have frozen shoulder, and so what you explain, you show it you show it to me now. So we did it on live session in front of everyone, and the range of movement increased around 20 to 30 degrees. The range of movement of when you put your shoulder in the back, so this range of movement basically takes longer time to come, but your reflection and those other range of movements, they are earlier to come, and you find remarkable even after first sitting of Marma therapy. However, we will need to do a few multiple times the same stimulation. And the best part is there was a patient in Mexico whom we did only once. He was long standing case, like more than 6 months, and secondary frozen shoulder, and then we did not give him any medicine, and I told him how to do it on his own. And after 1 month, he sent me another video, and his almost all the range of movement was back. So it depends upon case to case where you have to use medications and where you can do with only Marma therapy. Valentina from Italy is asking me a question, whether the Chipramarm is same as Angushtamul. See, what terminology that I use is has been given by Acharya Sushruta. Okay, so when Acharya Sushruta has talked about different marmas like Lohitakshani, Jan Urvi, Kurch Vitap Purpura, okay, Kokundare, Kakshadhare. So all the terminologies which Sushruta has used. So we use those terminology like Vaksho Marmani, Simant Tal, Chiprendriya Bastya, Katikatavre Brihati Cha, ya Nitambavidi Cha Tani. So these are like Kalantar Haranitu. So these are the descriptions or terminologies used by Acharya Sushruta. For example, that Sadhya Pranaharmaram, Shingatakani Adhipati, Shankau Kantha Sidagudam, Hridaya Bastinabi Cha Sadhyo Hatanitu. So these are the terminologies used by Acharya Sushruta, and we are using those terminologies. Rohit has asked me a question whether it should be done under expert. Yes, initially it should be done under expertise, because it is said that the marmas are very important. Acharya Sushruta has basically mentioned about marmas in the context that when you are doing when you're doing surgeries, you have to take care of those marma points, and so that you don't injure those points, because injury can lead into certain complications, so we have to be careful. However, when we talk about marma therapy, we say that we are not causing any injury, because the way we stimulate is very gentle, and we are almost doing many of the marma point stimulation knowingly or unknowingly in our daily day-to-day life. Like, for example, you put oil in the head, so there are many marmas in the head, and you are stimulating those marma points. Okay. Similarly, when we do in Ayurvedic procedures, there is a procedure called as Hriday Basti, then there is Griva Basti, and then there's a Janu Basti. Okay, so unknowing, we are stimulating the marma points, but we are not causing any injury, so we get the therapeutic results. So what is important here is to understand that the amount of pressure is, it can be less, especially for beginners, but don't go more. When we are doing self marma therapy, then I have not seen any people having complication, because generally, if you press like this, and if you feel much tenderness on your own, then you said, okay, no, I will not do it, right? So that acts as a protective mechanism, and that is why it is safer. However, when we are doing it for the first few times, it is better to be done under medical supervision. When to do use Chipramarm of lower limb? We are using in Chipramarm of lower limb in low back pain, osteoarthritis, knee. Hmm. In many cases, we are using Chipramarm lower limb. How many sessions should you take to see results in normal cases? There are Sandra has asked me this question: how many sessions should you take to see results in normal cases? So I said, even in the first session, we get results if I done properly, and if the case is not too long standing. As I just quoted one of the example in Bangalore conference. There was another conference in Ahmedabad around 1 year back. So I was giving again a lecture on that on this topic, and again a patient came on live with more than 200 people watching, and the patient had frozen shoulder, and we did marma therapy on that case live, and the patient's range of movement improved after 20 to 25 degrees in the first session itself. So it depends upon how you are doing, what is the chronicity of the disease, whether the technique that you are following is correct or not. And to sustain the effect, we will have to do it for a longer duration of time. Uh, Dr. Hema from USA is asking whether rotator cuff tear we can do it or not, but depends upon the degree of tear, whether it is and the involvement of other structures. So it depends upon that, right? We can do in rotator cuff tear as well, but it has to be only partial, and not too many ligaments should be involved. The next question is, can we use marma therapy in cervical spondylosis along with osteoporotic cervical changes, and which marma specifically does it work? Cervical spondylosis we are doing, so it is a degenerative disease. There are osteoporotic changes, especially in elderly women. So we are doing in that patients, and the aim of treatment in those patients is to improve the quality of life, to decrease the pain, and increase and decrease the dependence upon analgesics. And we have had some very good results in such cases as well. Some of the Manjunath has asked about complications. Some of the complications I have just said. That suppose somebody has a, if you press too hard on the uns area, don't go too close to the neck. And if even if you're trying to go do it right and you just press like this, and you certain have some giddiness or dizziness, you immediately lie down, raise your raise the limb, give a Trendelenburg position so that where there's better blood supply to the brain, and do the stimulation of Chipra and Chipra, Talhriday, and Sthapni Marm. So that complication can be managed like that. And similarly, if somebody, first of all, Kurpar Marm should not be done in patients having full stomach, so because in that case one can have nausea feeling. So in such case, just stop doing that. Again, the same procedure, just elevate the limb, and it will go on 5 to 10 minutes on its own. Sometimes the patient, if you are doing press too hard on the Cooper murmur, there can be swelling on the local site as well as some bluish discoloration, especially when the skin is soft. Okay, so if that happens, you don't do the Marma stimulation for 4 or 5 days, and generally subsides on its own. And otherwise, we can apply certain oil to reduce the swelling and pain. Keep doing the Chaperones stimulation, and also you'll have to do the tal. We have not talked about today, but there are many videos which we have put on YouTube. So you can watch my YouTube channel where we have described about that. From where can we learn Marma therapy? Is there any good? Suvita, we are conducting workshops to different parts of the world, different states of India. I have carried out workshops in nearly 15 states in India, and nearly a dozen countries abroad. So from time to time, we are conducting these workshops both for practitioners of Ayurveda, physiotherapists, acupuncture specialists, yoga therapists, modern allopathic doctors, and specialist doctors. We have conducted for different medical officers. There was a specific program in Himachal Pradesh where we conducted for many medical officers of the government of Himachal, and they are now also doing it, and they have sending their reports every month to the directorate in Himachal Pradesh, and most of them who are doing it are giving very encouraging results. There are other physiotherapists who have learned from here. They have come here to Dehradun and stayed with us from different parts of like in Europe, and now they are practicing. There another lady in Israel, doing very good work, Ofra, with Marma therapy and helping people with Marmas in Israel. And similarly, there are cases, there are people who are doing it in Mexico, USA, whom we have taught. So you have to come probably and learn it hand to hand, or join any of the workshops that we conduct, and then you learn it better, and then practice on yourself first, and then of course if you are a doctor, then you can practice on your patients. Veena Pathak's question is whether with this therapy is we use in paralysis. We are using it in hemiparesis cases, and we have had some very good results in hemiparesis patients also. However, that will take longer duration of longer duration of therapy, and we will need to involve other treatment protocols, like some of the Panchakarma protocols and some of Ayurvedic medicines, oral intake. But we are doing in hemiparesis patients, we are doing in avascular necrosis patients. Yeah, so many cases we are doing Marma therapy. Carpal tunnel syndrome also we are doing, yes. Mm, but we are doing one more Marm in carpal tunnel syndrome, that is Manibandh Marm. Yes, Marmas work in those patients also who have diabetic who have diabetes, and thus patients also marmas work well. Age group of marma therapy, as I said, it can be done uh, from from newborn to the elderly. Newborn, I am not doing, but there are some people who do even in newborn cases. The youngest patient I have treated is an 8-month-old baby. There is a there is another question regarding rheumatoid arthritis. Okay, so I conducted a session especially on rheumatoid arthritis in certain groups of US and I think Australian group also. We conducted special sessions on rheumatoid arthritis, and the aim there is again does not, it's not like RA positive becomes RA negative, but there are cases in which we have been able to take the patient off steroids, because most of the time in rheumatoid arthritis cases the patients are put on steroids, and you go on increasing the dose of steroids, and that ultimately that also becomes becomes difficult to take because it has some side effects, as we all know. So we have been able to do marma therapy and take some patients off steroids, and we, because in such cases we will need definitely to teach the patient how to do their own, because they will have to keep doing it for many months. Cervical radiculopathy, it works very wonderfully. Yet just in the last session when we were discussing about it, there is a physiotherapist in Nimhans, Bangalore. So he is also starting practicing marma therapy since last 1 year, and he gave very good feedback of cases of cervical radiculopathy, as we have seen in our class. See, if I am telling you this, then people can believe or may not believe, but there are many people whom we have taught in different parts of India as well as abroad, and they are giving very good results. One of them I would like to name, very good, is Dr. Raman Ranjan, Dr. Santosh Vishwakarma, who is doing in Government Ayurvedic College, Patna, the place where I did my undergraduation from. So I'm quite indebted to the place, and it's very good that now they are doing it in government hospital, marma therapy. Similarly, in government hospital and the place where I did my post graduation from, Himachal, so there Dr. Gaurav Parmar is doing it. So, and similarly in Himachal Pradesh, there are medical officers like Nitin, and there are many people. Another Dr. Gaurav is doing in Delhi. So we have taught them. And they are also getting good results, and there are many of them now teaching also in other places. So that is good to see. Basically, this is teachers' pride, basically. So in cervical, which are the marmas? I just told about that. In cervical, we did do three marma points. And one is ans, then the next is Cooper, and then the Chepra. If there is involvement of, if the involvement of due to involvement of this cervical spondylitis and spondylosis, if the pain radiates towards the occipital region, then there is one more marma that we need to stimulate besides these three. Also, in sometimes uh, the pain radiates more towards the scapular region, then there is another marma that we would have to see. But generally, these three marmas are the most important for cervical spondylitis patients. I think this is it, and I would like to end our session now. If there are any more queries, then you can put it on my on the page here, which is very well run by Suvendu Mitra. And thank you all for joining. It has been a great pleasure. feel free to ask questions. And of course, we will send an email ID. I'll write the email ID of mine here so that if you have any specific queries, you can write it later on my mail. I generally put, there's another question. I think we will answer the questions later on, because now I'm going to end the session. Thank you all for joining. And again, thanks, Suvendu. Thanks, Ofra from Israel. Many of you have joined from different countries in Europe, US, Australia. The different places have been watching this. I thank you all for coming. It's been a great honor. Namaste and all the best. Take care.